So a breast lift is really trying to address the droopiness and emptiness of the breast. So what you're trying to do is you're not changing the volume of the breast, it's just where you're putting the volume. So we're all fighting gravity. So with time, everything heads downwards. And what we're trying to do is put the breast tissue back up on the chest so you get nicer, perter, younger looking breasts. So it will lift the breast, it will lift the volume of the breast. And if you have a difference between the two breasts, then actually you can get a more balanced result. You can try and match each side by taking a little bit of a different amount from each side or lifting it a different amount each side so that you get a symmetrical result, as close to a pair of breasts as you can. So a breast lift is normally carried out under a general anesthetic. And there are different techniques to doing a breast lift, but invariably they involve different types of incision. So there are different patterns of scarring. If it's a very small breast lift, sometimes the scar is just around the nipple itself. So it's quite hidden just around the nipple, and certainly in clothing you wouldn't see it. If you need to lift the breast more, then there's usually a scar that goes from the nipple down vertically, and that's often called a lollipop incision. So it's like the round circle around the nipple and then a scar that runs downwards. And again, that scar is hidden in clothing, but it's more scarring. And then if you have to lift it even more, then you sometimes have to make scars along the lower crease of the breast. And that's usually called an inverted T or anchor shape. So you've got an upside down T shape, and that means that you can take away more skin and create a better lift and a more tightening effect. So broadly, those are the ways of doing it. There are sometimes additional bits to the surgery. Sometimes we liposuck fat away. Sometimes we put fat back into the breast to produce volume. Occasionally we put implants in. So we do the lift and an augmentation. So you not only lift the breast, but you also use an implant to fill the breast. So you're doing two things in that occasion. Yeah, so breast lift can happen on its own. When commonly when I'm doing the breast lift, it's just because the patient is happy with the size of their breast, but not the shape and the position. So you're just lifting it up. But occasionally, ladies come to me and say that they've lost the volume, particularly with weight loss and after pregnancies. So then you're having to put volume as well. So not only are you lifting and you're tightening the breast, but you're either putting fat back in, so that's lipofilling, or you're using an implant, so you're doing an augmentation to reduce the volume. So it's a combined procedure. So it happens at the same time, but you're basically restoring all aspects that the patient is concerned about. And those things, it makes it a slightly longer operation and slightly more complexity, but yeah, they can be done at the same time. So the patient should expect um, a better shaped breast, which sits higher up on the chest, so it's more pert, it's more youthful. The trade-off of doing that is that you have some scarring on the breast, but obviously that's only when the breast, when you're naked. Most of the time, the breast, will be covered. It will mean that the breast sits naturally in the new position. In terms of the scarring and the procedure itself, yes, the nipple can have reduced sensation, and that's not uncommon because the nipple has to be moved from lower down to a little bit higher up, and in doing so, sometimes the little nerve endings can be injured. Occasionally, the nipple can become more sensitive. So actually, rather than reduce sensation, it can be a little bit more sensitive. Most patients, accept that, and there's a slightly difference in sensation, and it isn't a big problem, and usually it doesn't last a long time. And you would hope that once you've done a breast lift, then it will last again for a number of years. The patient needs to obviously stay healthy and fit and well, but it can produce really nice natural results. Okay, to increase the duration of a breast lift, it's basically doing everything to try and fight against gravity. So again, you want to try and if you the breasts are lifted up, you want to keep them up. So simple things will be wearing a good underwear, so a good supporting bra. Some patients tend to wear the same support bra or a sports type bra most of the time to support their breasts, and particularly when they're doing sort of strenuous activity. The other thing is just staying healthy. So maintaining a stable weight is really key. If your weight changes again, your breasts can increase in size. Or if you lose lots of weight, they can reduce in size, and that can change your result. And it's all about healthy lifestyle. So keeping fit and active, a good diet, not smoking, and just staying well is the key thing. Not doing anything different really, but just being sensible with your lifestyle.